morning everyone. This is Dr. Vignesh Kumar, physiotherapist working in Government Medical College Hospital, Pudukottai. Today I just wanted to speak and demo about some few exercises to prevent the falls and fractures in old age peoples. Because nowadays we can see the common silent thief is osteoporosis. Even now predetermined age after 50 we should be aware of this. So because of the lack of calciums in the bone, so bone becomes more softened to get more amount of fractures. Very commonly prevalent to get fractures in hips, spines, shoulders and wrist joint. So we have to do a checkup, like annual health checkup. We have to do a checkup for bone mineral density to find out whether there is any osteoporosis or not. So under the prescription of orthopedic doctors or physicians, we can consume some supplements like vitamin D as well as calcium tablets. Along with that, we have to undertake by the supervision of physiotherapist tailor-made exercises to prevent the falls and fractures. So I am going to explain the preventive protocol, how to do the exercises in a simple way, because the exercises which is based on four important pillars. They are balance, which is inadequate in the old ages, and aerobics, cardiopulmonary capacity will be reduced, so we have to train that. Next is strengthening, muscles and the joints all becomes weak when we become aged, so these are all the aging ailments. And endurance, so totally it is called as base. B for balance, A for aerobics, S for strengthening and E for endurance. So based on this, there are 26 exercises which has been categorized by Dr. Andrew Fullerton from Toronto, Canada. She has been explained in his research paper. So I just concised the 10 to 12 exercises to understand what is going on. So after this we can get idea, and each and every individual has to consult a doctor and come to physiotherapist direct access for individual prescription of the exercises, because each and every people's need unique exercises program by the physiotherapist. So we can watch the practical demo. Hello everyone, just I am going to explain about the practical demo of exercises. This exercises actually consist of important three things. One is wall and walking corridor, as well as chair and some dumbbells for strengthening exercises. So these concise complex of exercises consist of balance, aerobics, strengthening and endurance. Now the first exercise is chair. Holding the chair and just grasp it and raise the heel like this. This is the first exercise. Do it for 8 repetitions. Now raise the toes. Chair must be more strong enough to do it, because otherwise it may cause a falls like this. Next, single leg stance. Just holding it and standing on single leg. And again standing on single leg with the opposite leg bending. And the next thing is just taking off the hand and just standing on the single leg for the balance. And next, taking off the hand, just standing on single leg. These are all for the balance. I'm going to explain about the walking exercises. Walking in the corridor just for 1 minute. Like this. Walking with short steps. One step forward and another step. One step forward and another step. This is called tandem walking. You can watch the footsteps. This is called tandem walking. Same thing, we can walk backwards. This should be done very, very carefully, because to prevent the falls. So tandem walking, walking backwards. Next, standing on this side and walking sideways. This is very important exercise to strengthen the gluteal hip muscles, because it's a common place to get the fractures. So side walking, opposite side towards wall. Next, strengthening exercises along with balance. You can strengthening exercise, just rise the dumbbells like this and walk with tandem. Next, same exercise we can do backwards. This should be done very carefully. See the footsteps and holding this weights. You can rise the weights like this or with any bean bags also, like this. Next, holding the weight like this, walking sideways. Same thing, walking sideways. Relax. Now I am going to explain about 6 stand exercises, squat exercises without any weights. Sit down on the chair and getting up. Sit down on the chair and getting up. Sit down on the chair and getting up. Just touching the chair and getting up. So this is the simple exercises to get the balance and strengthening. The same exercises which can be followed with weights. As if you can see, rise with weights, you can rise and sit, rise and sit, rise and sit, rise and sit. Next exercises, I just going to explain about the strengthening exercise for the arm muscles, because old ages very commonly the muscles becomes weak. So rise this with the dumbbells, just hold the arm and do for elbow bend and stretch for the triceps. Like this. Then return back 8 repetitions. Again rise, slowly bend and rise. 8 repetitions. Next is for biceps. Just leave down the hand, gradually bend and stretch. For right hand is concerned, for the biceps. Simple exercise with light weights. We can use with the help of elastic or TheraBands also. Like this. Next I am going to explain about stepping exercises with the right foot and returning back to the right foot. Stepping with the right foot and returning back. This is the initial phase of balance training for the stair climbing for the old age peoples to prevent the falls. Next, stepping up with the left leg and return back to the left. So left foot up, left foot down, left foot up, left foot down, up, down. The same thing we can apply for the stair climbing also. Now I am going to explain about the stepping up. See, rising, coming back, rising, coming back, rising, coming back. Again left foot up, left foot down, left foot up, left foot down. These are all the exercises which can be given for balance training. Next exercise I am going to explain in the walls. See, just this is called as a wall angel exercise. Just rising and touching and return back. Rising and touching the both hands and return back. Simple endurance exercises. Touching and return back. Touching and return back. This is 8 repetition. Next, the same sliding of the wall, chest stretching the both hands, mild squatting by sliding the body over the wall. So wall squat, chest wall squat exercise. 8 repetitions. It can be increases to 10 to 12 repetitions. So this can be done with weights also for strengthening. It's concerned. Just sliding on the wall, holding both dumbbells, just rise and up, rise and up, rise and up, rise and up. But it should be done very carefully. We can reduce the weight also. Next, final exercise. I'm just going to explain. It's called as a wall push-ups exercise. Just hold the both hands and stand on the feet apart, sliding. Do a push-ups. 1, 2, 3, 4, 5. Like this we have to do and finish it. Also some few exercises based on balance, aerobics, strengthening and endurance to prevent the falls and fractures from osteoporosis. So if we follow this for half an hour daily, definitely we won't get decalcifications of the bones, but it must be done under the supervision of physiotherapist. So people get an awareness, and even those who are watching, doctors, physios, physio students, budding medical students, staff nurses, please come forward, check with the orthopedic surgeons for bone mineral density and get an advice from physiotherapist. Thank you.